Hello, everybody.
Hi. President, wonderful.
Nilesh, it's good to see you. This is going to be
Yeah.
fun to do together.
You too, Stu. I know.
See,
Hello, Delegate.
Hi.
how are you, Delegate Bhandari? It's good to see you.
Good to see you. Are we on live? Yep. I think we are on live. And we will start shortly.
I have a quick question for you, just logistics. So regarding presentations, are you going to run the presentation, or should we share our screen and run it from our end?
You can run through. I mean, from there, you will be co-host. I'll make sure that you are the co-host.
Okay.
That sounds good. Thank you.
Wonderful.
Thank you.
Let me make that both co-host. Make co-host. And yes, it's all done. Since we are on live, we could start. Reese, you want to go ahead and start?
Yeah, hi. Hi, yeah, my name is Reese Peak. I am Delegate Bhandari's Chief of Staff, and I just want to give brief introductions to our participants who have chosen to be with us today. Dr. Nilesh Kalyanaraman is currently the Deputy Secretary of Public Health at the Maryland Health Services. Deputy Secretary of Public Health Services at the Maryland Department of Health. He served as the health officer in Anne Arundel County, driving COVID response, gun violence intervention, and their community health initiatives. He has over a decade of experience at federally qualified healthcare centers, advanced care transformation, integrating social determinants, innovative reimbursement models, and enhancing access to underserved communities. Dr. Stuart Levine is currently the president of MedStar Franklin Square Medical Center and senior vice president for MedStar Health, overseeing one of Maryland's largest community teaching hospitals. With nearly a decade of leadership with MedStar Health, he previously served as president and chief medical officer of Harbor Hospital, expanding their behavioral health service as well. Dr. Levine is also a board certified rheumatologist. So thank you, guys.
Okay. You're mute. There's some. Yeah. Grace, are you there?
Yes.
Okay, go ahead. I'm sorry. We lost you. Go ahead.
I already gave the.
Okay. Yeah, thank you. And we have our president, Dr. Stuart Levine, president of MedStar Franklin Square Medical Center, and a senior vice president for MedStar Health, overseeing one of the Maryland's largest community teaching hospitals. With nearly a decade of leadership within MedStar Health, he previously served as president and chief medical officer of MedStar Harbor Hospital, expanding behavioral health services and crisis intervention program. And Dr. Levine, a board certified rheumatologist, has a rich medical background including a faculty position at the Johns Hopkins University School of Medicine. Beyond his administrative and medical roles, Dr. Levine is a recognized voice in the medical community, with publication in various medical journals and active participation on several prominent boards. And as we convene here today for our health the town hall, our mission is clear: to foster an open dialogue, share critical updates, and address the pressing healthcare needs of our community. And your presence here signifies
Reese, I think the delegate is frozen. Nilesh, we're still on, right?
Yeah, you guys are still on. I apologize for that. Let me let's just, yeah, if everyone could just turn off your cameras, and then when we'll be ready, we'll let you guys. You want to start from the beginning when we get there?
Yep, our guest could start.
All right, guys, sorry about that technical difficulty, but if our guests could start, that we'd be happy to get going.
Wonderful. Delegate Bhandari, I think you'd asked me to start, so I'd be honored to do so. I'm going to share my screen. I've got some visuals to help. Reese, is that working? Do you see the screen share?
Yes, I do.
Okay. Second. Okay. So Delegate Bhandari, I just want to thank you for this kind invitation, and I want to start by thanking you for all of your support of MedStar Franklin Square and our associates, especially during the pandemic years. It's been a long road for the hospital and our associates, and we could not have come through with the success that we have and being able to care for our community during this time without your incredibly generous and gracious support. So thank you and all of your colleagues in the legislature for your support of both our hospital and all healthcare providers throughout the state. It is my honor today to share a little bit of what we've been up to at MedStar Franklin Square, how we are working, especially in the post-pandemic era, to partner with the community to improve community health, and certainly to partner with Dr. Kalyanaraman and his colleagues in the Department of Health in the state to collaboratively work to take care of the healthcare needs of our community. I'd like to divide my comments into a few sections, and then they'll each be brief, but I'd like to introduce and reintroduce MedStar Franklin Square to those that are participating. We've been in this community for a long time, and the hospital has changed a lot over the years, and our offerings have changed as well. So I'd like to reintroduce the organization. want to just cover a little bit of the current healthcare landscape, especially in the post-pandemic era, and I'm sure that Nilesh is going to cover some of this as well. Just the era that we now find ourselves in, and some of the strains and stresses on healthcare systems, but also on our patients and our communities as they access care. Of course, we're going to talk about what's on everybody's mind, which is hospital capacity, throughput, and especially emergency department wait times. I am sure that there are some questions, Delegate Bhandari, from your constituents about this really important topic, and I'm certainly happy to engage in that and answer any questions that come through. And then I want to talk about our work in the community, especially as the every 3-year community health needs assessment process is well underway, and we're going to talk about that in a few minutes as well. So a reintroduction to MedStar Franklin Square. So as many know, we have been on this campus for now almost 54 years, moving from Baltimore City to this location in Baltimore County in the late 60s. The campus is almost unrecognizable now from those early days. We've had tremendous growth over the years, supported by incredible demand and use from this community. As Eastern Baltimore County has grown and developed over the years, so too is the hospital. I've had colleagues and friends from all over the state, come and visit the campus, and those that haven't been here in a long time always marvel at all of the development, all of the new buildings, the new programs, and just the incredible buzz of activity happening on our campus. And we are really proud. We are one of the largest hospitals in the state of Maryland, and we are the largest hospital in Baltimore County, and we take that position and the honor of being in that position very seriously, as we're going to talk about. Like everything, we really are blessed with where we are located. The map that I'm showing you here, the red marker is MedStar Franklin Square, and the H's surrounding are just other area hospitals. Upper Chesapeake to the north, Johns Hopkins Bayview to the south, and the Towson Hospital, St. Joseph's, and GBMC. There are of course others. I just show you this to say that we draw patients from a very, very wide area, and that's going to become important when I talk in a few minutes about our community health needs assessment and how we are soliciting input from our broad community that we serve. We are, as I said, one of the largest hospitals. We have one of the largest emergency departments in this area. We are an accepting center for high acuity care, largely transported via ambulance and via helicopter to our helipad. And we really are a regional large hospital. So we are a community hospital, but we also serve an important regional role for a large and growing part of the state. As I said, we're big. We're a 354-bed hospital. We see about 30,000 patients either admitted or placed in observation status. Those are patients who need to stay with us for a short stay. We have several hundred, almost 200,000 outpatient visits, somewhere in the mid-60s, 60,000 in terms of annual emergency department visits. We are one of the largest employers in this area with, around 3,000 associates, hundreds of affiliated physicians, and as the delegate said in his kind introduction, we are a major teaching facility. We've got hundreds of medical residents, surgical residents, and family practice residents. So a very rich learning environment, which also helps us bring innovative care to our community. I like to describe our hospital as a community hospital with a tertiary care elements. So a community-based tertiary care hospital, and it wasn't always that way. This was a growing and large, basically community hospital. But in the last several years, we've invested in services that you, the community, have told us you've needed. We have expanded our stroke care service, and in the next 2 weeks, we will be going through an evaluation period, or an evaluation visit from both the Joint Commission and the state's EMS program through MIMS to become the latest and newest comprehensive stroke center in the state. This will bring the most advanced stroke care to this community when it hasn't been offered here before. And so what that means for the community is that for all advanced strokes, no longer will people who live in this community have to leave this area and go to other area hospitals and larger hospitals in the city for advanced stroke care. We're also expanding our cardiovascular services, bringing expanded interventional cardiology services again, so patients with heart disease requiring cardiac catheterizations can get that care right here in the community. Again, we've heard you loud and clear. You've told me in my tenure over the last several years as president of this hospital, this is what you want. You want care in the community, and you want it accessible, and easy. And so that's what we are committed to bringing. We have one of the largest robotic surgical platforms, advanced surgical platforms in the state of Maryland, performing over 20,000 surgical procedures a year, from the most simple to the most complex. And we are increasingly, as I said, becoming a regional referral center for these types of services. But all of that, while it's important, if we're not taking care of the basic medical needs of our community, then we're not serving you well. And so we have a commitment to our women's and infant services, delivering close to 2,400 babies a year. And we're really proud of our both the volume of service we provide, but also the wonderful health outcomes. And again, many of those occur through partnerships with community-based organizations to care for patients as they leave the hospital, which of course is really important. We have a very well-developed behavioral health program here, serving both adults and children and adolescents with mental health needs, both in the inpatient setting and in the outpatient setting. And we're partnering with the state to think about ways that we can expand those services, which we know are so desperately required in the community. And our emergency department, for many years was the busiest in the state of Maryland. It is no longer, but we are still in the top 5 or 6. But as I'm going to talk about in a few minutes, we are one of the most acute, or one of the places that takes care of some of the sickest patients and the ones with the greatest needs in the state. And some of that plays into why sometimes the wait in our emergency room is too long for those who come in through the front door. And we'll talk about that in a few minutes as well. I'm really proud of the accomplishments of the hospital, and we are well awarded. The work that our clinicians do across the range of our services is recognized by both local and national organizations, and we are really, really proud of the work that they do here every day. And of course, many, many, many of our associates are residents of this community. They've grown up in this community. Their families use this hospital as well. As does mine, and so they're just really proud to be able to provide this care for their friends and neighbors and colleagues. What you may not know is what a incredible center of nursing excellence we have here at Franklin Square. And over the course of the last several years, I know that there's been a lot of discussion about the nursing workforce and the number of nurses that are retiring and leaving, and how it's so critical to create the absolute best environments for our nursing colleagues to come back into the hospital and want to care for our patients. And I'm thrilled that over the last several months, we've seen significant increases in new to practice nurses coming back to the hospital. So nurses who had left on travel assignments during COVID to go to other parts of the country to provide their services are coming back. And we recently learned that our hospital was awarded the coveted magnet designation from the American Nurses Credentialing Center, one of only 604 hospitals in the country. So roughly 10% of hospitals in the country earn this status. And in the state of Maryland, there are only 8 that have received this status. And MedStar Franklin Square is the only hospital in the state of Maryland to have received this designation 4 times. And each of these designations is for a 5-year period. So over a 20-year period of time, we have seen sustained nursing excellence here at Franklin Square. And what that translates to for patients coming here is an outstanding care experience and an outstanding level of nursing professionalism. And as the final bullet on this slide demonstrates, it is a significant recruiting advantage. And when we think about all of the places that nurses can come to work, we want them to come and work here in Eastern Baltimore County. We want them to come here to be able to care for you and your families. And we are increasingly seeing that being a magnet hospital is exactly what it sounds like. It is a magnet to bring the very, very best nurses to our organization. And so just really proud of the work that they do every day, keeping us in that highest level of nursing excellence on a national level for all of these years. And it's working. As I mentioned, we've hired over 100 new to practice nurses over the last 6 months. One of the most wonderful parts of my job is that I actually get to attend and speak to every new nurse class or orientation class. They've been some of the biggest classes that I've ever seen over the last several months, with people who are just energized. They're so smart. They are so committed to taking care of patients, and they're coming back into the hospital setting now post-COVID to care for our community. What they want is flexibility. They want to be able to have some less restrictive scheduling, and we've increased the what we call our flow pool, our nurses who can work in various parts of the hospital. We've almost tripled the number of nurses who are coming into the organization in a flexible schedule, and what that means is far more flexibility to staff our units fully with the staff that we have and the new staff that are coming in. And all of that helps to improve our hospital capacity and our throughput, and ultimately to move people who need to come in through the emergency room up much quicker. And so I'm really excited that we brought so many new people into the organization that I know already is starting to help move patients through our system in a much more efficient way. We had one of the largest nurse residency programs in our recent memory, welcoming 67 nurses who came on last year, worked for their first year as they were learning the ropes, and are now fully integrated into our nursing workforce. And we are working with academic organizations and nursing schools and nursing programs all over the region, but most proudly with CCBC. We are blessed to share a campus with CCBC Essex, and we have a long history of partnership with their nursing program, and having many of their nurses do rotations and then come and work here. We have a growing relationship with Hartford Community College for the same types of programs, with Stevenson University, Notre Dame, with Hopkins, and with Towson. And we keep expanding those partnerships to provide all of these workforce development opportunities and bring really talented people into our community. So that's MedStar Franklin Square. For those that know it, hopefully it's been a nice refresher. For those who may be new to some of the things we're doing, I hope that you've learned a little bit. And again, I'd be happy to take questions during the appropriate time a little bit later in this program. So I want to move now just to talk for a few minutes about what we're seeing in terms of some of the stresses. And I'm sure, Dr. K, you have a unique perspective on this as well in your work, in all the work that you've done over your career in the various places you've worked, but especially from your vantage point from the Department of Health. The issues affecting healthcare, are in some ways, some are unique to healthcare, and some really are not unique and are just part of the overall landscape that we are all experiencing now. Obviously, inflationary pressures, everything that we do and that we use and that we buy in the hospital is more expensive, as it is for all of you. And trying to strike that balance between affordability, making sure that patients who have insurance, patients who are struggling to get insurance, can afford the health care that increasingly is becoming more expensive. That is a real pressure for everybody. And we, of course, need to be part of the solution in how we make sure that we can continue to deliver those services in a way that are accessible and affordable, but understanding that everything, as you're feeling with everything you're purchasing in every other aspect of your life, is more expensive. And so that is an overall driver of one of the major post-pandemic stresses that are affecting healthcare. Of course, I've talked over the last several minutes about the workforce recovery and people coming back into the workforce. We are, there's a large workforce, a healthcare workforce study that has recently been commissioned that found that we are many thousands of healthcare professionals short of what we need to fully provide all the care that we need to in the state of Maryland. And as I just gave maybe a little bit of hope over the last few minutes, we certainly see, people coming back to work and really talented people coming back to healthcare organizations. But we still have a long way to go as a state to bring back not just nurses, but radiology technicians and care associates and pharmacists and every other team member that makes a hospital and a healthcare system work. We need all of them to come back, and we need to partner with the state and with colleagues around the state to help make that a reality. Access to care is everything from a patient and consumer and community standpoint. If you can't access the care, it doesn't matter how good it is, it doesn't matter how world class it is. If you can't get in to see a doctor, if you can't get into the hospital, well, then that doesn't work for you. And we're well aware that that is the number one issue when we talk to patients. It's all about accessing care. And so we know that patients have a lot of preferences now in terms of how they're doing it, and healthcare organizations need to be offering a full range of services, whether that's after-hour services, whether it's telemedicine services, whether it's services via apps and mobile devices and smart devices. All of those things are part of the landscape now that we are all as healthcare organizations working hard to figure out and to partner with the community to make sure that we've got the right mix of services that suits you and the way that you want to receive healthcare as we go forward. And then we need to continue to innovate, right? If you're just doing the same thing, then you're falling behind. If you're not constantly getting better, then you're falling behind. And our community deserves the absolute very best of that modern healthcare has to offer. And so we are always thinking about innovative new care delivery models here at Franklin Square and across MedStar Health, and asking how we can bring those new models to bear. This is not an exhaustive list. There are so many trends, but I just wanted to give you just a few of the things that sort of as a hospital leader and healthcare leader, some of the things that I am concerned about. And of course, access to insurance is, kind of, and is one of the main gateways, of course, that allows anyone to access care. So again, something we also work very closely with Dr. K and his team at the state level on. Okay, I want to talk a little bit about hospital capacity. This is a really, really critical issue, and I'm really honored to be working with you, Delegate Bhandari. And thank you for the work that you're doing advocating on behalf of patients. I'm one of the hospital members privileged to serve with on Delegate Bhandari's work group and task force, the commission through the General Assembly in partnership with the Maryland Hospital Association. We've been meeting over the last several months with stakeholders from across the state and working with the delegate and his colleagues in the Senate to do a few things. One, to diagnose the problems. Why is it that in Maryland we seem to have more trouble moving patients through our system than maybe some other surrounding states? And are there some innovative and creative things that hospitals are doing in this state that we may be able to all learn from? And ultimately, we've all committed to improving our throughput, seen through the lens of emergency department wait times, but understanding that the wait in the emergency department is just one aspect and really one symptom of a larger issue where the whole system is not moving as efficiently as it should. And so we've taken that on, and Delegate, it's just truly an honor to work on this with you and your colleagues. And I found that the discussion is thoughtful, and I really believe that we will come to some meaningful solutions over the next several months that statewide will be able to start improving some of these issues. But just a little bit about MedStar Franklin Square. We are a little bit unique. Some hospitals in the area have had to limit capacity over the last few years for various reasons. We have actually expanded our capacity here at Franklin Square. Some might be surprised to hear that, but when I started here 3 years ago, we were a 338 licensed bed facility. We are now a 354 bed licensed facility, and we are staffing and utilizing those beds. So we do not have any closed capacity at MedStar Franklin Square. And some of what I just told you about our staffing and improvements in our staffing levels have allowed us to keep these beds open and therefore available to you and your families as you need our care. The challenge we have is that what's different than pre-pandemic is that between 15 to 20% of the daily of our beds in this hospital, it's 60 to 80 beds a day, are occupied now by patients who are no longer need really to be in an acute care hospital, but really don't have a safe and efficient and appropriate option for discharge. And there's various reasons for that, whether it's issues with a guardianship, whether it's other hardships in the home, whether it's difficulties accessing home care or post-acute care or nursing home care. There's a lot of reasons that can happen, and we are actively working with the delegate and the work group to think through some of the ways that our colleagues in Annapolis could help with some of these issues with accessing post-acute care. And in doing that, we would really have significantly increased capacity to bring more patients up in an expeditious manner from the emergency department. So that is different. Before the pandemic, that number was much smaller. It was below 10%. And so we were able to bring more patients per unit time up through the hospital. Our overall hospital length of stay was lower at that time. Emergency departments feel as busy as they ever have, and they're getting there. We were in the last few years at about 85% of our pre-pandemic volume. We're getting closer now, probably to the high 80s, maybe close to 90%, but we're still not back to where we were before. And of course, those of you that know Franklin Square know that we've always been very, very busy in the emergency department. What's changed, though, is that the patients who are coming are sicker than they were at this hospital before the pandemic. We have very, very few patients coming for what you might consider urgent care types of problems, more minor problems. Most of those problems, of course, you're now going to urgent care centers and doctors' offices to take care of. And so our challenge is that we have fewer patients that we're caring for than a few years ago, patients that are coming are sicker and are requiring a little bit more time and a little bit more diagnostic workups to figure out what the issues are so that we can start to treat them. We still discharge between 70 to 75% of the patients who come to our ER. That might sound like a high number, but 25 to 30% of an admission number through the ER is one of the highest in the state. So it does tell you that the patients coming here really are higher acuity. We remain in the top 5 in the state for overall volume, but we are either number 1 or 2, depending on the year, in terms of ambulances coming to a hospital. So we get more ambulances than some large hospitals whose names that you know. And often people are surprised to hear that Franklin Square is one of the number 1 or 2 destination in the entire state for ambulances. And so sometimes if you're waiting, if you've had the experience of waiting in the emergency department, if you haven't come to our hospital by ambulance, most likely what is happening is that many very sick and critically ill patients are arriving around the same time by ambulance. And our challenge is how to figure out how to better care for all of the patients who are coming through, both the really critically ill and of course those that just need our care and need our diagnostics. We're developing a number of new models to try to improve our wait times. We have brought in a number of new practitioners, licensed practical nurses, working with our clinicians, our physicians, our PAs, and our nurses to think of different care pathways, different ways we can try to bring people into the system. But ultimately, we need to improve our communication. If you're waiting in my waiting room and we're not communicating with you, that is a failure of me, it's a failure of my team, and we take accountability for that. We're working very hard to try to improve that experience, understanding that it is not pleasant to wait for care when you're not feeling well. And I'd like to end, Delegate Bhandari, thank you for allowing me the time. I want to just spend a few minutes talking about our community-based programming. This is a really important time of the year in that we are literally in the last few days of our every 3-year community health needs assessment as mandated by the Affordable Care Act. But as I told a colleague earlier today, even if this wasn't required, this is work that we need to be doing, and it is so critical for us to be doing as healthcare leaders and as healthcare providers. We are in the process of soliciting advice and input from you, from the community, in terms of what should the priorities be for our hospital and our health system over these next 3 years. You see from this map, Franklin Square, and I showed you now 2 maps, we take care of patients from a broad and diverse geography. Our patients have a number of needs, and we need you to help us make the right priorities so that we're bringing the healthcare and the programs and developing the partnerships that you need, not the ones that we think you need, but the ones that you tell us you need. And that's, when we think about partnership, that's really the essence of partnership. In the last survey, you told us that health and wellness, chronic disease management, access to healthcare services, as I mentioned a few minutes ago, and working on those social determinants of health, those items that impact health to a significant degree, housing, food insecurity, employment insecurity, racism, racial discrimination, care disparities. You told us these were the important things over the last few years, and we've listened to you, and we have a number of programs that we have put into place to help address each of those issues. I want to put in a little bit of a plug since this is officially one of the last days. We're going to be collecting surveys through the weekend. I want to direct everyone, if you haven't filled out a survey, it only takes about 5 minutes, medstarhealth.org/community survey. There's a QR code here on the screen. So if you can snap the QR code, it'll take you to the site. It only takes about 5 minutes to fill out. It is available in a number of languages. Again, and the languages chosen are reflective of the community in the area that we serve. So being very sensitive to know that we've got a diverse community, and we want to make sure that we are available and getting feedback and input from the full diversity of our community and the rich diversity that exists. So please, you got a few more days, but let's partner in the community health needs assessment so that we can develop the plans together for the next few years. We've done several things as a result, as I said, of our community health strategy. I'm working with our community health worker programs. I'm going to show you some data in a second that shows just the incredible value of these programs, bringing community members in to help connect our patients to services and to care that they need, understanding the community and being from the community, such an important resource and an important connection. We have a wonderful substance abuse screening program and peer recovery coach connection to care program. It's something, Nilesh, you and I spent a lot of time over the years talking about and strategizing. And I look at the mobile health clinic, and when I was at MedStar Harbor Hospital and Dr. K was running the health department in Anne Arundel County, we worked together on programs, on mobile health programs for the county to figure out how we partner, how the government and how hospitals could partner to bring the best care and the most coordinated care to patients. And I'm proud to say that we have been working with our federal legislators to bring another mobile unit that MedStar Health has acquired into this area so that that our community can benefit from the mobile services that we've been able to bring to Baltimore City and Anne Arundel County over the last several years. So really, really proud of this. We've got some targeted strategies. We have a food prescription program that we have rolled out. We've got transportation initiatives partnering with Uber to make sure that we can help facilitate patients getting to their appointments, because again, access is so important, and working with a whole host of community partners to try to connect patients to the care that they need when and where they need it. We're working to make sure that when people leave the hospital, that they stay well enough to not have to come back to the hospital, so that they could stay in the community for their care. So we have a number of programs where we have nurses and televisits and other resources to make sure we're connecting patients when they leave the hospital to the community care that they absolutely need and deserve. And then a number of programs trying to work to improve the overall health of the community, whether it's our Healthy Babies Collaborative, working with new moms to make sure their babies and families to make sure their babies are healthy, tobacco cessation, diabetes prevention, many community outreach events, partnering with wonderful organizations like the Community Assistance Network, the county and County Department of Health, the Baltimore City Department of Health. And then we have a Children's Community Health Services grant that MedStar Franklin Square provides to several community-based organizations for programs that improve children's health. And we're really proud of those programs. Don't want to spend too much time on this, just want to show you just the numbers of patients we are touching with some of these programs. Almost 4,000 patients connecting with our community health advocates, and then connecting to programs that will help with some of those social determinant issues, some of those food insecurity issues, housing insecurity issues that we talked about, making a real impact in the lives of our patients in our community. From a substance abuse disorder perspective, again, linking hundreds and hundreds of patients who need to be connected to outpatient care for that care. And we know with the fentanyl epidemic and how deadly some of these substances can be, it is more critical than ever to connect people who are suffering from this disorder to the community-based care that they need. This truly does save a life, and the people that do this work are just truly spectacular, and they're doing it right here in this community for our community. Our food program, we talk about, the work that providing healthy food, what that does for a community. We really believe in healthcare that food is medicine, especially for some disorders like diabetes and high blood pressure and heart disease. It can mean everything. And we also know this is an area of significant health disparities, especially racial inequity. And this is some data that I'm showing from our regional-wide MedStar program, showing reductions in some of the health disparities and racial disparities in diabetes control when patients are provided with access to healthy food and timely follow-up. I've already mentioned the Mobile Health Center that we are proud to bring soon to Baltimore County and to this community. And so, in summary, we are focused on all of the issues that you as a community tell us you need: access to care, transitions of care, social determinants of health, and just engaging and being out at community events and making those connections and having you feel that the hospital isn't just a place you come when you're sick, but it's a place that actually can help you in your journey to wellness and to stay well. And so I just can't thank you enough, Delegate Bhandari, for inviting me, giving me the opportunity to spend this time with you and your constituents, our community members, our partners. It's truly an honor, and I'm delighted to have the opportunity. And again, we just want to thank you for your tremendous leadership and advocacy for the health and healthcare of our community. Thank you so much.
Yeah, thank you for the wonderful presentation, President Dr. Levine, and your expertise and dedication to healthcare are invaluable, and we greatly appreciate your presence here today. And definitely we'll hear from our Deputy Secretary, Dr. Nilesh Kalyanaraman, and we'll come back to our questions and answer session towards the end. Our Deputy Secretary, Dr. Nilesh Kalyanaraman.
Thank you, Delegate Bhandari. Give me 1 second. Let me pull up my presentation, if I can find it here. There we go. Everybody can see that. So thank you, Delegate Bhandari. I appreciate your support for health in the community. It is critical to have our leaders, our elected leaders, really championing health. And thank you. It's always a pleasure to follow Dr. Levine. Stu and I have interacted in many forums over the years, and it's truly a pleasure to be with you here. So thank you for having me. As Delegate Bhandari noted, I'm the Deputy Secretary for Public Health, and the Secretary Scott, sends her best regards. She wasn't able to join us today. I want to talk about some of the key priorities that we have at the Maryland Department of Health. And it's a lot, obviously, and I want to just touch on each of them just to give you a sense of them. And I know there'll probably be questions afterwards, but these are some of the core priorities we have: addressing childhood poverty. So much of the health issues that we see in children are due to poverty. Dr. Levine talked about the social determinants of health, and this is probably one of the most powerful ones that really does bend the arc of health. Talking about our behavioral health continuum of care, the entire range of services that are offered throughout the state, and what we're doing as a Department of Health to make sure that we are bolstering those that are strong and also filling the gaps of those items where there's lack of services throughout the state. Of course, we have to hit on the respiratory virus season: COVID, flu, and RSV. No presentation will be complete without that. I do want to touch on health coverage, community violence, maternal health, and lastly, and I think probably most importantly, is how we partner with community-based organizations and faith-based organizations, because we can't do this work by ourselves. This has to be done in partnership with our community organizations. So when we look at the Moore Miller administration, their commitment, it's to leave no Marylander behind, to end childhood poverty, and then particularly for us, really looking at how we are addressing the total cost of care in both through population health and health equity, looking how we're creating real-time access to high quality, equitable behavioral health care. And I mentioned our behavioral health continuum of care. And then lastly, really focusing on protecting and improving reproductive health and health outcomes for mom and baby. There we go. Just a brief note on the structure. Our Department of Health is a very large department. It has 5 divisions: public health, of which I am the lead, but also healthcare financing, which focuses on Medicaid, behavioral health, developmental disabilities, and then our operations, which operates our Maryland healthcare system, which is a set of 11 hospitals and other facilities that provide a range of behavioral health services. So let's start with childhood poverty. Governor Moore's child health priorities, a range of them, particularly those, and Delegate Bhandari will recognize all of these, but a range of priorities that really look to address child health and child poverty across a range of issues. So looking at educators, making sure there are enough educators in our schools, looking at our waiver programs in Medicaid to make sure that we end wait lists in critical programs, particularly things like home visitation and home services. Looking at gun safety and violence prevention and interruption are really critical pieces of how we can keep people safer. Firearm safety storage requirements and youth suicide prevention, and really getting that piece around not just whether there are guns, but how they're stored safely and how we can prevent youth suicide. Looking at consumer protections against price gouging, which we particularly saw during COVID, but happens at other times as well. Looking at victim support services, and then of course making sure that we have adequate nutrition. Stu talked about food. Food is medicine. Well, food is critical. A hungry child does not learn. So the first item I want to touch on is childhood poverty and what we're doing as a department to address that. One of the key things that we're focused on is implementing the blueprint for Maryland's future. That is the Kerwin Commission, as you may have heard of as well. This is really important in terms of addressing how we're going to make sure that each child gets a world-class education. One of the things that we're looking at is school-based health centers. We do have school-based health centers which provide primary care and some other healthcare services beyond what the school health nurse can do. And it's really critical to be able to expand that program. And we are in the process of getting more schools signed up for that throughout the state to provide those services. We know the research shows that when in schools with school-based health centers, we see educational attainment go up. And so it is a critical piece of our plan. Making sure that children can continuously be eligible for Medicaid. A lot of the rules for Medicaid were suspended for Medicaid re-enrollment were suspended during the public health emergency. But as that has ended, those rules are being put back into place, but we want to make sure that we don't drop kids from coverage who should be covered. We're also making sure that kids are staying with their family, and particularly working with Secretary Lopez at Department of Human Services to make sure that children stay with their families, particularly those immigrant children who are coming. We know that there are many different waves of refugee or asylum programs that are occurring. People do move to Maryland, and we want to make sure those children stay with their families. And then there are other programs that we continue to have and invest in, like our WIC program, which is a nutrition program for women, infants, and children, and our home visiting programs, which provide supports to expectant mothers and new mothers for home visiting services to address a range of needs that family might have to make sure that they're successful. Of course, I mentioned the behavioral health continuum of care, and then workforce training is really critical. We have a shortage of workforce in health across a range of workers. Once again, nursing gets a lot of attention, but this is true in behavioral health as well, critically, that there are shortages, and we are looking at how we can improve that pipeline throughout the state. And so I wanted to dig in just a little bit on some of the Medicaid waiver programs that I mentioned, a couple of them. So the model waiver for disabled children, making sure that we're able to take advantage of these federal dollars and these Medicaid funds to expand access. So for disabled children, for children with autism, for children with rare and expensive medical care, oftentimes those children struggle to be insured, and we want to make sure that they get the coverage and the care that they need. And then lastly, Maryland Health Homes, particularly to address children with serious emotional disturbance, to make sure that they're able to get the comprehensive set of services they need. One key note that I want to bring up is that we have expanded Medicaid to allow to provide 12 months of coverage for postpartum for new mothers, and we have expanded Medicaid to allow coverage for people who would otherwise qualify for Medicaid, except for the fact that they're undocumented. They are now eligible and can be on Medicaid if they're pregnant, and for 4 months after delivery. And we're looking to increase that increase the time that they are covered after delivery over the coming years. I want to switch over to behavioral health, and I think this is probably one of my favorite slides because it demonstrates the range of behavioral health care that exists throughout the state, all the way from prevention, looking at how we promote health, make sure that we have general outreach and outreach to specific communities, then looking at more targeted prevention, so looking at preschool services for children who are at higher risk of having health issues, looking at suicide prevention in the population, substance use disorder prevention, and then getting more and more specific. So looking at programs like I mentioned, home visiting, mental health first aid, which trained individual, just like you have first aid, and you know people who are trained in first aid know how to administer aid to people for a medical issue. Mental health first aid allows people who don't have medical or health backgrounds to understand how to recognize mental health issues and direct people to the care that they need. From prevention and promotion, we look at primary behavioral health, which is really just like what you think about your primary care provider, right? Provides a baseline level of behavioral health services, both mental health and substance use disorder, includes some case management. These are all community-based services. And then also some special, more specialized programs like drug court or outpatient detoxification. And then critically, as we're talking about substance use disorder, medication-assisted treatment. Substance use disorder is a chronic disease, and it can be managed through a range of healthcare services, including medication where appropriate. And being able to increase access to these services is how we're good, is an important part of how we address the opioid crisis. Looking to the next, urgent acute care, just like when you need urgent medical care or need to go to the emergency room or get hospitalized, this is the same thing on the behavioral health side. So things like a 988 hotline for people who are in crisis, providing urgent behavioral health services, and crisis stabilization centers. Mobile crisis teams are a part of this. And then yes, emergency rooms and inpatient admissions are also, when needed, available. And then the last is treatment and recovery. So after there's an acute care episode, how do people live with these chronic diseases, and what are the types of treatment that we're providing? So in terms of long-term treatment, things like residential treatment programs, PRPs, residential treatment centers, and then recovery supports, things like recovery communities, permanent supportive housing, respite care. And this gives you a sense of the full spectrum of care that we're looking at to make sure that we've identified all the areas that A, need additional services, and B, where are they located and which populations are not getting served. And then, as I mentioned, making sure that the areas where we are doing well continue to receive that funding. And so there's a range of investments that we're making in behavioral health, looking at our collaborative care model statewide, which really is a primary behavioral health care delivery model, increasing the number of mobile crisis teams, so making sure that we're able to provide that urgent care services, and that's $22 million, investing $24 million to create crisis stabilization units. And those are locations where people can go to get screened, assessed, stabilized, treated, and then referred to community treatment as needed. The best way to think of that is as a combination of urgent care emergency room for behavioral health issues. And then moving further down the continuum, $10 million to support up to 25 high-intensity complex adult and youth from the hospital overstays list that aren't able to be supported by current providers. One of the big challenges we have in the state is that there are people with complex behavioral health issues who are unable to get hospitalization, end up staying in emergency departments, and this is challenging for hospitals because they are always committed to providing care. But what we want to do is make sure people get care in the right setting and the best setting for them. And then also making sure that we're expanding access and investing in sites throughout the state, such as the Whitsitt Center or the Brook Lane Hospital. I'm going to move over to our fall respiratory season. I get a lot of questions about this, as you can imagine. What's going on with COVID? So I'm going to back up for a second and say, what's going on with COVID, flu, and RSV? As we have come out of the public health emergency for COVID, what we're seeing is that all three of these viruses have similar symptoms and can lead to hospitalization. Obviously, as we've all lived through, COVID is more severe than the other two, but at this stage of COVID, after about 3.5 years since it first made its presence known, the vast majority of people have some level of immunity, some combination of being exposed to infected and being immunized. And so we're keeping a close eye on the number of hospitalizations and infections that are happening due to all three of these viruses. And so the thing that I want to focus on more than anything else is what you should do. It's important to remember that we know all the tools of what we need to do, right? It's important to, if you start to have symptoms of any of these, right? Cough, fevers, stuffiness, sore throat, get tested. COVID tests are still readily available. Get tested. And whether you have COVID or not, stay home if you're sick. Do not pass it on to others. And of course, get vaccinated. There have been a number of changes in the past few months. The recommendation is that everybody 6 months or older should get the new updated COVID vaccine. And just like we do with the flu vaccine, which is updated every year because flu changes. The flu virus changes, and there's a reason we get a new flu shot every year. It's to keep up with those changes. And that's what we're doing with the COVID vaccine this year. So we're seeing that COVID vaccination rates are really low. I encourage you all to get your COVID vaccine, your updated COVID vaccine. I got mine about a week ago. My younger daughter did as well. And my wife and older daughter, I believe, are going in about an hour. So it's in my arm, get it in your arm. At the same rate, everybody should get everybody 6 months and older should get their flu vaccine as well. I got that with my COVID shot, easy peasy. And then lastly, one of the new vaccines that's out is the RSV vaccine. And we get a lot of questions about this. RSV is a type of virus that tends to cause the most problems in people at the youngest age range. So infants, and then in the older age ranges. And so there's a vaccine that is now available for anybody 60 years and older, particularly in this group because they're at higher risk. And the more chronic illnesses or health conditions you have, the greater your risk. There's a recommendation that they should consider getting RSV vaccine. It's certainly available. And we encourage you to either get it if you're 60 or older, or if you have any questions, please talk to your provider. And then the last category that I want to talk about is pregnant individuals should talk to their provider about getting the RSV vaccine. That was just approved a few months ago as well. That was approved for women who are between 32 and 36 months of pregnancy. That's typically going to be done in concert with your OB, but we do want to make you aware of that. The last one that's not here, but I want to mention is the RSV. We call it a vaccine. It's a monoclonal antibody, but that is available for infants, and that is a new indication. There are some shortages of that medication. It's called Beyfortus, but we strongly encourage you to get that. And we are working with hospitals and pediatricians to try to get increased supply and make sure that certainly those infants who are at the highest risk get that vaccine. And we're trying to let everybody know about this, right? One of the hardest things to do is keep up with with how much information changes. So we're letting healthcare providers know, local health departments know, and we're also including this information throughout the state through a general media campaign. So my one ask for you is to get your vaccines. And if I have a second one, it's to let your friends and family know. Healthcare coverage is really important. As Stu mentioned, care is only good if you can get it. And so we want to make sure that, particularly in the case of Medicaid, I mentioned that during the public health emergency, the rules for everybody who's on Medicaid has to renew every year. And what we saw during the, during the public health emergency, that Medicaid enrollment grew during that time. And some people who were no longer eligible were still covered. And that was a good thing during the pandemic. But we have to, now that the public health emergency is over, we do have to adhere to the federal rules on Medicaid enrollment. And so what we're doing is we are doing eligibility reviews again. It began in April, so about 6 months ago, and everybody is going to get a redetermination letter. We are working very hard to make sure that every single person who is eligible remains on the rolls. And so we really want to encourage you that if you get that letter, or if you get notification that it's time for Medicaid, for you to reattest to Medicaid, please call back and make sure that you do that. We don't want anybody to lose coverage. Part of this is getting the word out. As I mentioned, we're making sure that we're blanketing the airwaves on this one. It's really critical. And we're also working with our managed care organizations who operate most of the Medicaid services, human services, the health benefit, CRISP, community-based organizations, and grassroots organizations, and be happy to share this information with you to share with your community organizations as well. And then lastly, I want to talk about coverage for undocumented Marylanders. This is always an issue. About 6% of Marylanders were uninsured in 2022, and it's estimated that about 30 to 40% of the uninsured are undocumented Marylanders. I mentioned that the Healthy Babies Act went into effect July 1 of this year, and that provides coverage for undocumented Marylanders who are pregnant during their pregnancy and up to 4 months after delivery. We thought that there would be about 6,000 people who use this Medicaid coverage in the first year. About 4 months in, we've already seen 3,800 women. That is fantastic. We would love to go over that 6,000 number. The more women who are eligible for this who take care of it, the better care that can be provided. This is an issue, violence, and I know that there's a lot in the news about this today, particularly, but unfortunately, it seems like there's a lot in the news about this every day, particularly. Violence, particularly gun violence, kills over 2,200 Marylanders each year. And we see in our state about 15.2 deaths due to a firearm per 100,000 people each year. So we're kind of in the middle of the country on this. The majority of deaths occur in younger adults, and it's a significant number of people and years of life lost. And what we're seeing is that Black people experience a 10-fold higher rate of homicide compared to white people, and white people experience a 2-fold higher rate of gun suicide than Black people. And what we're trying to do is change the paradigm of how we think about violence. It's not inevitable, and it is a health issue. It's a health issue because people get injured and people die. And more importantly, it's a public health issue because we know that there are strategies to be able to prevent violence, to be able to interrupt it before people even need treatment for their gunshot injuries or wounds. And so this is an area that we are focusing on. How are we going to address this? And we're developing a public health framework to be able to do this. That looks at data, understanding the data, and it's why I shared that in Maryland, about 60% of gun deaths are suicides, about 40% are homicides. And mass shootings, which get the most attention in the media, are a very small fraction, just a few percentages of those homicides. So understanding that data, understanding where it occurs, and then looking at how we're implementing evidence-based strategies to address this is our approach, and that's one that we're going to be developing over the coming months and years. Women's health is another priority area for the department and for the governor as well. And as we look at it over the course of a life. So what are the needs during adolescence and before pregnancy, and then during pregnancy, at birth, and then in the postnatal period, and then lastly during motherhood. And there have been a number of bills addressing reproductive rights and making sure that women have access to the full spectrum of healthcare. Things like ensuring the right to reproductive freedom, protecting information around certain reproductive services, making sure that higher education have reproductive health, higher education, certain colleges and universities have reproductive health services plans, making sure that we're implementing abortion clinical care training so that there are more providers who are able to provide those services. And then making sure that in the context of, a changing federal landscape and Supreme Court decisions, that we have access to the medications, that providers have access to the medications they need, including mifepristone and misoprostol, to be able to provide abortion services to women as a routine part of their healthcare services. We're also focused on maternal health and health disparities. And I think that it's really important to recognize that in particular, Black mothers are the most affected group when we talk about maternal health disparities. We see 43% preterm birth rate among Black women, and it's 43% higher than the rate among all other women. In 2018, Black mothers in Maryland passed away due to childbirth-related complications at a rate of 44.6 deaths per 100,000. That's 3.7 times higher than white mothers. And in Maryland in particular, we're seeing that maternal deaths and maternal morbidity injuries are higher than the national average. And so we have a laser focus on this issue to be able to get this down. We have programs that we're working with birthing hospitals, 32 birthing hospitals around the state to address the warning signs. We're working to expand access to doulas who can provide supportive care throughout the pregnancy, to be able to pay for that service through Medicaid, to be able to train additional doulas so that we can expand that workforce, to increase home visiting services, and yes, to provide greater behavioral health services as well during the pregnancy and postpartum period as well. And so we'll be interested to talk more with communities about what are the needs they see and how are these interventions, are they helping? Are they not enough? Where do we need to do more? And then lastly, I just want to touch on a key point here, which I mentioned at the top, which is community-based organizations and faith-based organizations. As Dr. Levine knows, I used to be at federally qualified health centers, which are called community health centers, for a long time prior to entering public health. Community-based organizations, faith-based organizations, they're doing the work in our communities. They know our communities, and they know them, frankly, at a level that is intimate and greater than any of us can who do this health work. And the only way to actually achieve these goals that we have to reduce and eliminate disparities, to achieve health equity, to improve our health outcomes, is to partner with them. Not just to understand what they know, but to support them to do the work so that they can be a part of the solution in their communities. We learned a lot of lessons from the pandemic, and one of the key ones we learned is infrastructure. So a lot of the community-based organizations, faith-based organizations, they are not used to how to handle government grants, how to handle larger amounts of money, reporting requirements. That's all the stuff that's needed on the business side of things. And so we are partnering with the Institute for Public Health Innovation to be able to provide support to CBOs, FBOs, to be able to understand those operational pieces so that they can do what they're good at and be able to manage funds and continue to grow as they provide services. And so that's one of our key initiatives, and we'll be expanding that program over the coming years. So with that, I want to thank you, Delegate Bhandari, for the opportunity, and I will turn it back over to you.
Yeah, thank you, Deputy Secretary. Our collaboration with Governor Westmore, as you highlighted, prioritizes economic mobility, commitment reflected in so many of healthcare bills that we passed. The AGO Health and Government Operations Committee is one of the busiest committee in the General Assembly. In this past legislative session, we tackle a number of key priorities that will help bolster the health of people, community, and the public institution, as both of you highlighted. That is important to help public institution across our state, and from capping the cost of prescription drug to bolstering our state cybersecurity, eliminating co-payments for diagnostic breast examination, helping folks with hospital bills, and increasing transparency at the state and local levels. That I'm proud of my committee's work this year, and I'm very much grateful to our committee chair, Penia Melnick, our speaker, Andian Jones, wonderful leadership, and Senate President Bill Ferguson, and every delegates and senator leadership. And the presentation was wonderful. I'm going through all these questions. Most of the question was answered. However, Reese, would you like to read a few questions, one each, due to the time constraint? Reese,
of course.
Go ahead.
Yeah, one of the questions that we got from the chat was about how does the Maryland Department of Health plan to engage, and you kind of answered this already, but collaborate with local communities. Or can you expand upon that just a little bit more?
Sure, happy to. So there's a couple of ways in which we do that. One, we recognize that that local communities are working largely with their health departments, with their local hospitals, with their community health centers, and we're really not trying to replicate that. And so our goal is to make sure that we tap into that, talk to the local healthcare organizations, and work with community-based organizations that way. That said, we do provide funding and, as I mentioned, support for community-based organizations to do this work, sometimes through direct grants, but mostly in partnership with our local health departments.
Great. And then the kind of same question over to President Levine. Can you share kind of the initiatives and strategies that Franklin Square has with partnering with local community organizations and faith-based organizations around?
Yeah, Reese, thanks for the question. And it's really everything. If you think about a hospital, right? I mean, we're a big building or a set of buildings. We are in the community, but our community, as you saw from our maps, is many, many, many miles of circles around where the hospital is. And so if we are to have any impact on community health and on public health, as opposed to just episodes of care where people come in, they're sick, we take care of them and they go out. If we're to have any success at all, and I would submit we must, as an organization, have success in improving the health of the community. That is absolutely core to our mission. We have no choice, and we relish partnering with community organizations. And I'll just give you, so we partner with over 100 community organizations of every kind, but I want to focus on one particular one because Dr. K actually mentioned community health centers. He and I continue to serve on the Board of Healthcare for the Homeless. Nilesh was, of course, the chief medical officer of that wonderful organization for many years. When I was at Harbor Hospital, I worked very closely with Family Health Centers of Baltimore, which is the community health center in South Baltimore. And at Franklin Square, we work very closely with Baltimore Medical Systems, which is the large community health center in this area. And we partner in a number of ways to help provide care and access to care for the community. So we partner with specific programs in maternal health. We actually have several of our providers on site at Baltimore Medical Systems sites around the area providing care. We've linked our electronic medical records and health records so that we have transparency and sharing of information. And we are thinking about the issue of emergency department waits and access, thinking of ways if one of the patients who's cared for by primary care physicians in those clinics, how we can have direct communication to say, hey, one of your patients is in the emergency room for a reason that you might be able to handle in your clinic. Can we make sure we'll take care of them, of course, for the acute setting, but can we figure out a way to connect them better to care so they don't have to come to an emergency room or expect to come to an emergency room for care? So those connections are absolutely critical. There is no way the hospital can do this on its own, and it shouldn't, but it absolutely must connect to all of those partners. So that's one example. There are many, many others with food access and transportation and all the rest, but partnership is absolutely everything. And in all honesty, it's what the community demands. The community demands of us that we partner to take care of them to the best way that they deserve to be cared for. And it's something that I believe in wholeheartedly, and I'm so proud to help facilitate in our local area.
Great. Very well put. It seems that we are over time. Doug Bhandari, any final thoughts or anything from the panel?
Yeah, thank you. I'm deeply grateful to my district constituents for the privilege to serve in the Maryland General Assembly and for your invaluable support as we will start 2024 legislative session soon, and your willingness to share your thoughts on the bill that has played a crucial role in the successful passage in the past, and I hope the same. And in closing, if we do have from our guest, Deputy Secretary and President Levine, do you have anything to add before we do our closing?
Just once more, Delegate, I want to thank you for your leadership. And I think the message of this whole session has been the value of partnerships. And we couldn't do the work that we do without partnerships with the Maryland Department of Health and, of course, with our elected officials. So just thank you for your partnership, your support, and your wise guidance. It's truly appreciated.
Thank you. Deputy Secretary, last word.
Yeah. Yes, thank you, Delegate Bhandari, for having us here. And I just want to end on the note that health is something that we all do every day. It's not something that we keep at either the department or in the healthcare space, but it's something that we're all engaged in every day.
Thank you. In closing, I want to once again express my deepest gratitude to our distinguished guest, our Deputy Secretary, Nilesh Kalyanaraman, and President Levine for sharing their valuable time and expertise with our constituents today. And your contribution are instrumental in shaping the health landscape of our community and our state. And let's continue working together to ensure a healthier and brighter future for all Marylanders. And thank you so much. Thank you, everyone.